Today we're diving into the immune system, the body's defense team. To really understand how it works, we'll start with the basic anatomy, then move into natural and acquired immunity, compare humoral and cellular responses, and finish with some key players like immunoglobulins, the complement system, and immunomodulators. When nurses assess immune function, it's not enough to just look at labs. You need a working knowledge of the anatomy and physiology behind it all. The immune system isn't a single organ. It's an integrated collection of cells, tissues, and molecules that work together to fight infection. The big components include the bone marrow, lymphoid tissues like the spleen and lymph nodes, and specialized immune cells. Bone marrow is where all white blood cells are produced. From stem cells, we get lymphocytes, the B cells and T cells, which are the foundation of immunity. The spleen acts as a filter. Its red pulp destroys old or damaged red blood cells, while its white pulp houses lymphocytes. Lymph nodes are like checkpoints spread throughout the body. They filter lymph fluid, trap foreign material, and give immune cells a place to multiply and prepare for battle. The immune system's core job is to recognize what's foreign, respond to it, and restore balance, a process we call homeostasis. The first line of defense is natural or innate immunity. This is nonspecific, meaning it reacts the same way every time, no matter how many times you're exposed. It's fast, broad, and doesn't require memory. The cells of innate immunity include neutrophils, the first responders at sites of inflammation, eosinophils and basophils, which are especially active during allergies and stress responses, monocytes and macrophages, the powerhouse phagocytes that engulf and destroy invaders, and natural killer cells, which are specialized cells that attack abnormal or infected cells. Innate immunity kicks in through two stages: an immediate response that begins within minutes, and a delayed response that develops over a few days, buying time for adaptive immunity to take over. This system also relies on physical and chemical barriers like intact skin, mucous membranes, cilia, gastric acid, and enzymes in tears and saliva. A key feature of innate immunity is the inflammatory response: redness, heat, swelling, and pain caused by chemical mediators that minimize blood loss, wall off invaders, recruit phagocytes, and start repair. Innate immunity is powerful, but it can't always handle sophisticated pathogens. That's where acquired or adaptive immunity comes in. Unlike innate immunity, acquired immunity is specific, adaptive, and has memory. You gain acquired immunity in two ways. Active immunity occurs when your own body makes defenses after infection or vaccination, and this can last for years or even a lifetime. Passive immunity occurs when you temporarily borrow defenses, such as antibodies passed from mother to infant through breast milk or an injection of immune globulin. Acquired immunity has two main mechanisms. In the humoral response, B cells mature into plasma cells and produce antibodies. In the cell-mediated response, T cells activate and directly attack pathogens. When an invader enters the body, three defense mechanisms take place. First is the phagocytic immune response, where granulocytes and macrophages engulf and destroy the invader. Second is the humoral immune response, where B lymphocytes produce antibodies that circulate in the blood. Third is the cellular immune response, where T lymphocytes transform into cytotoxic or killer T cells and attack directly. This process unfolds in 4 stages. Recognition occurs when immune cells detect antigens as non-self. Proliferation follows as lymphocytes multiply in nearby lymph nodes. The response stage comes next, with B cells making antibodies and T cells attacking. Finally, in the effector stage, antibodies or killer T cells neutralize or destroy the invader. Humoral and cellular responses differ in their focus. Humoral immunity, which is B cell driven, targets bacteria, toxins, and some viruses, and is responsible for allergic reactions, anaphylaxis, and immune complex diseases. Cellular immunity, which is T cell driven, handles transplant rejection, delayed hypersensitivity reactions such as the tuberculin test, graft versus host disease, tumor surveillance, and intracellular infections like viruses and fungi. In humoral immunity, B cells recognize antigens and transform into plasma cells. These cells produce antibodies, which are large proteins called immunoglobulins. Some B cells become memory cells, allowing faster and stronger responses when the same antigen appears again. Antibodies defend in several ways: by agglutination, which clumps invaders together, by opsonization, which coats invaders with a sticky substance that makes them easier to engulf, and by activating the complement system, which launches a cascade that enhances destruction. There are 5 major classes of immunoglobulins, each with unique roles. IgG makes up about 75% of circulating antibodies. It's found in blood and tissues, crosses the placenta, activates complement, and provides long-term defense. IgA accounts for about 15% and is found in secretions like saliva, tears, and breast milk. It protects mucosal surfaces and passes through breast milk to provide infants with passive immunity. IgM makes up about 10%, is the first responder during infection, and is mostly in the bloodstream where it activates complement. IgD is present in small amounts, about 0.2%, and helps regulate B-cell differentiation, though its role is less well understood. IgE is present in the smallest amounts, but it's powerful, driving allergic and hypersensitivity reactions and defending against parasites. While antibodies are critical, T lymphocytes drive cellular immunity. Helper T cells, also called CD4 cells, activate the rest of the immune system and release cytokines. Cytotoxic T cells, or CD8 cells, directly kill infected or malignant cells. Suppressor T cells keep the immune response from going overboard, and memory T cells remember past antigens for faster responses the next time. Other players include null lymphocytes, which destroy antibody-coded antigens, and natural killer cells, which kill infected or stressed cells and release cytokines to boost defenses. The complement system is another critical player. These are plasma proteins made in the liver that circulate in the blood and are activated when antibodies bind antigens. The activation sets off a cascade effect, with one protein activating the next. This process helps defend against bacteria, bridge innate and adaptive immunity, and clear immune complexes and inflammation byproducts. Complement can be triggered in 3 different ways. The classic pathway starts when antibodies bind antigens. The lectin pathway is activated by sugars on microbial surfaces, and the alternative pathway is triggered directly on microbes. While complement is usually protective, chronic or misdirected activation contributes to autoimmune diseases and chronic inflammation. Cytokines are chemical messengers that coordinate immune responses. For example, interleukin-1 induces fever and inflammation. Interleukin-2 stimulates T-cell growth. Interleukin-6 promotes antibody production. Interferon gamma activates macrophages. Tumor necrosis factor alpha causes fever, inflammation, and sometimes cell death. Finally, immunomodulators are agents that boost or modify immunity. Interferons are antiviral and anti-tumor proteins used in conditions like multiple sclerosis and hepatitis. Colony-stimulating factors stimulate the bone marrow to make more blood cells. Monoclonal antibodies are highly specific lab-made antibodies that target diseased cells, especially in cancer therapy, where their precision allows them to block signals tumors rely on. So to bring it all together, the immune system is a complex network of cells, tissues, and proteins that protects the body. Innate immunity is rapid, nonspecific, and always on. Acquired immunity is specific, adaptive, and has memory. B cells and antibodies dominate humoral immunity, while T cells drive cellular immunity. Complement and cytokines amplify responses, and immunomodulators are powerful therapeutic tools. Understanding these foundations is essential, not just for passing exams, but for making sense of how the body responds to infection, vaccines, and disease.